If you frequently suffer from heartburn and think nothing of it, you might want to think again. Do you also seem to have poor sleep and sleep disturbances? What you could have could be something much more serious. Joining me now is Dr. Ronnie Fass, Director of Gastroenterology at MetroHealth Medical Center, to explain. So welcome to the show, Doctor.
Thank you.
So if it's not just heartburn, what could it be?
Well, it's probably gastroesophageal reflux disease, but I have to mention that heartburn is probably the most common presentation of the disease, although not always heartburn means gastroesophageal reflux disease.
So you don't have to needlessly worry, but it's a possibility out there. So I've heard that also called GERD or GERD. That's easier for me to say, so I want to ask you about what causes this GERD.
So the main cause for gastroesophageal reflux is really a dysfunction of the sphincter between the esophagus and the stomach. That leads to reflux of acid into the esophagus, and consequently patients may develop symptoms and inflammation of the esophagus. Okay,
and it's painful like heartburn. That's probably the first symptom. So how dangerous can GERD be?
Many people don't know that gastroesophageal reflux disease can lead to complications, and the most common one is severe inflammation of the esophagus. But it can also lead to ulcers in the esophagus. It can lead to the appearance of precancerous tissue in the esophagus called Barrett's. And in some cases, it can lead to cancer of the esophagus, which is, by the way, the fastest rising cancer in this country.
Oh my goodness. Is that because everybody's under stress and they have more and more heartburn and acid reflux?
Well, part of it, and the other part is because we're all increasing in weight and eating a lot of food.
So just like everything else in medicine, it seems like exercise and eating right can play a part in it as well?
That's correct.
Okay. Now, you're talking about the esophagus mostly, but does this disease affect other parts of your body in some way?
That's correct. So the disease is not only limited to the esophagus, and that's important to know. It can involve a variety of organs that are close to the esophagus. For example, the lungs. It can lead to asthma. It can lead to breathing problems. It can lead to even something what we call pulmonary fibrosis. It can involve the throat. It can lead to hoarseness, chronic cough, and cancer of the throat. And it can even lead to involvement of the mouth or the teeth. It can lead even to teeth cavities.
Oh my goodness, is that because the acid actually comes back up into your mouth and can eat away your enamel?
That's correct. So the acid can reflux high enough and end up in your mouth, and as a result lead to teeth cavities.
My goodness. So if we have viewers that might be thinking, oh, this is just heartburn, I mean, should they just assume that, or what should they do at the point where they're a little worried about it and they've heard you now? What to do?
It's very important to understand that if you have heartburn, it may mean more than just simple reflux. That means you need to see a physician or to be tested. But I would like to emphasize also that you can do a few things to improve your symptoms.
Okay.
For example, you can do some lifestyle changes. Lose weight, like you mentioned, pursue exercise, elevate the head of the bed, and then try to avoid large fatty or spicy meals.
Mm-hmm. Wow, been good information and advice today. So GERD has been the fastest rising cause of cancer in the country. And if untreated, it can cause a myriad of problems affecting the esophagus and your other vital organs. If you're experiencing any of these symptoms, go see a doctor before it's too late. My thanks to Dr. Fass for helping us to understand GERD.
To learn more, call MetroHealth at 216-778-7800 or visit their website, www.metrohealth.org. Next.